What's going on, guys? What's going on?
What's
Welcome
going
to
on?
another broadcast of Urban Renal Talk with.
Tamika and Steve.
What's going on, Tamika? What's going on? Happy birthday.
Happy birthday. Yes, it is our first year anniversary.
Yeah, absolutely. Well, Tamika, actually, this is the second year. We just celebrating the first year of Urban Health Outreach because you remember we started in 2017
Yeah.
doing Urban Renal Talk with
Right.
Tamika and Steve.
Well, it was kidney talk.
Yeah, kidney talk.
Mhm.
Yeah, kidney talk with Tamika and Steve. And we
Yeah.
started that too. And we never really did a celebration show as we planned because of other things kind of came into the picture. So
Right.
hopefully tonight we could do some of it and extend it maybe through the whole month.
Right. Right. Yes.
Yeah.
So
So,
the
huh?
should bring back some of the old guests and see where they at today.
Absolutely. So Tamika, tonight, man, we was fortunate to have Don M. Dawson,
Mhm.
the new CEO for Kidney Sake, which
Okay.
that position founded by Angela L. Davis.
Yeah.
She recently unexpectedly passed away. So we're fortunate to talk with Dawn Dawson and get her perspective and see the direction of For Kidney's Sake, which is based in I hope I don't get it wrong. I want to say Brooklyn, but Brooklyn, New York, but Don would tell us. So let's bring her on to the show. Hey, Don, how you doing?
Hey guys, congratulations. Happy birthday.
Thank
Oh, thank
you.
you. Welcome to Urban Reno Talk.
Thank you.
How's it? So where are you? For kidney's sake, is actually
Queens.
located.
Queens.
Oh, it's Queens. Okay, no disrespect. I'm sorry.
Okay. I'll
I
forgive
know
you
how
this
the
time.
boroughs are.
I'll forgive you this time.
She said she
Right,
could do
right.
it this time, Steve. Don't get in trouble.
Okay. So, Don, this is pretty much your first interview since Miss Angela passed away. So, how's it been going since that?
Well, um, it has been trying. It has been difficult, but we're starting to find our way slowly but surely. We were having a hard time in the beginning. We were mourning, and it was difficult for all of us.
I'm
But
sure.
yeah, but things are starting to move along. We see clearly now, and we know what we have to do.
Hmm.
So it's getting better.
So, Don, how did you meet Angela?
I met Angela through a friend on Facebook. Um, so a friend of mine, I was on dialysis, and a friend of mine said, "I have a friend that's on dialysis too. Her name is Angela. Maybe guys should link up." So she linked us on Facebook, and Angela and I started speaking on Facebook. And she said to me one day, she said, I'm going to start this organization called For Kidney's Sake, and I want you to be a part of that. I
Mm.
said, oh, okay, but she said, I'll let you know when. So at that time, when she said that, I had just got my transplant. So she said to me, when you get yourself together and you're all healed and you're ready, you know, come on, and we can do this. So I said, okay. So throughout that time, we kept in touch, and Angela was very, I don't know, just she was just such a good spirit, and it was just such a connection. So
Hmm.
there's a Facebook group called Dialysis Uncensored, I believe,
Hmm.
and she put a post on there saying, I'm looking for a transplant recipient to be on my board. So I instant messaged her right away, and I said, "Here I am. I'm ready."
Mm.
And so she said, "Okay." She asked me to send her my resume. I had to fill out a board application, and then we had our first board meeting with everybody, and the rest is history. But the funny thing is that when I got my transplant, when I woke up, the first thing I said was, "This can't be it." There's something that
Mm-hmm.
I have to do for my people. My friends are still on dialysis. You
Mm-hmm.
know, um, and I said, there has to be a way that I can give back. I didn't know what I was going to do. I didn't know how I was going to do it, but I knew that there was a way that I had to give back. And then came Angela and For Kidney's Sake.
Wow. So, what is the philosophy of For Kidney Sakes? Because I want to be honest. When I first started Urban Kidney Tamika, this was back in 2014. I used to see a lot of Angela stuff on Instagram. I used to see like her banners and
Mm-hmm.
her events and everything. And I will be honest, when I first, I was a little envious because I wanted to be there where she was at, or, what I saw. But
Mm-hmm.
I know that that wasn't my time. But
Mm-hmm.
I mean, she really had what I saw from the outside of her events and everything. They would look well put together. So, what was the y'all philosophy? Because I saw y'all do different themes, like a man cave, and did something for women. Um, so, talk to us about that. She just wanted to try to make patients feel quote quote normal or whatever that is.
Well, our goal, we are a social organization and we battle depression and isolation in dialysis patients.
Oh, wow.
And in doing that, we have events, social events. We have dinners. We have our yearly patient awards dinner. We have the man cave. We have the pink and pearls because we want to bring the patients out.
Mm-hmm.
Because patients can tend to stay isolated because when you become a dialysis patient, you lose friends
Yes.
because you can't really drink. You can't eat the same things that they eat, so you tend to stay isolated. So what we do is we bring them out to hang out with people like us. You know, um, we try to let patients know that dialysis is not the end of life. Angela's motto was, "I have kidney disease, but kidney disease doesn't have me." And we try to let patients know you can always find joy. There's still a life to live. That machine is just a part of your life. You have a whole nother life to live, and you
Mm-hmm.
can, So I noticed that at our events, like maybe like the pink and pearls, the patients, the ladies come and they wear the little pink and they wear their pearls, and then
Mm-hmm.
we have a DJ and they're dancing, and our goal is to make them forget about dialysis and to remember that they're beautiful and that they can still party and dance and be happy outside of dialysis.
Absolutely,
Mm-hmm.
absolutely.
Yeah.
So to piggyback off, our other guest joined in. Uh, you know her, Dawn. I mean, y'all both had the same name. No stranger to you, fellow New Yorker, CEO of CKD Kidney Champs, New York State. Without
Mhm.
further ado, Don P. Mormon. What's going on, Don?
Hey everybody, how you doing? I'm so sorry I had technical issues. How you
No, we
doing?
all did.
Happy
Mm-hmm.
anniversary, everybody.
Hi.
Uh, thank you, Don. So Don Dawson was just reflecting on for kidney's sake and what their philosophy is and what they do. Now, me and you talked, and you knew Angela as well. What did for kidney's sake mean to her, in your opinion?
Oh boy, I don't even know if I could appropriately articulate this. For kidney's sake was everything to Angela. We sat down and we talked as leaders of organizations. We shared ideas and we talked about our mission for our respective organizations. And she just, what she wanted was she wanted patients not to feel isolated and alone. And she wanted to be a part of helping patients get out and be engaged and to live their lives, just like what Dawn was saying. She said, she said a lot of those things to me as well. And it was the real depression issue that was her focal point, because so many patients suffer from depression, and it's something that's not appropriately evaluated, it's not treated. We just go back and forth to dialysis and there's no life afterwards. And Angela was not about that. She was about, come on, let's go get it, and I really appreciated that about her. We're
Mm-hmm.
just gonna miss her so we're gonna miss her so much. She was just such a vital part of what we are doing up here in New York. But I know For Kidney's Sake is strong, and they're gonna make that comeback, and and they're gonna continue what it is that Angela put out there in that mission, because she's got a great team of really dedicated people.
That's awesome. So, Don
Yes.
Dawson, um, is this something that you prayed over? Like, I know you may feel like you got to fill some big shoes, but do you feel like this is a position that needs to happen for the organization to move on to continue Angela's legacy?
Well, first, let me say that Angela's shoes were not one size fit all.
Right.
Angela's shoes could never be filled at all,
That's right.
ever. So
Hmm.
that is not my goal to fill Angela's shoes.
Well,
My
no, no, I
goal,
don't.
my goal is,
I didn't mean to say
no,
like
I know that. I'm just
right.
saying my goal is not to fill her shoes. My goal is to continue her legacy and to follow her dreams and to continue her dreams. At Angela's memorial service, when the service was over, her brother came over to me and he said to me, he said, listen, and he pointed at me. He said, don't you let For Kidney's Sake fall. He said, that is my sister's baby. That was her life. Don't you let that organization fall. And I said, okay. He said, promise. And I said, I promise. At that moment, I did not even think about being CEO. You know, um, I was still in shock. I did not know where we were going to go from there, but I knew that For Kidney's Sake was going to go forward.
Hmm.
I felt that, that was my friend, that was my sister, and she did so many things. She changed my life. So it's only right for me to keep her dream alive, and keep it going, not only for her, but for my people, for my warriors, because
Hmm.
they
Hmm.
need this. They need this organization. So yes, I prayed over it. You know, when I first realized that I was going to be CEO, I had a panic attack. I was really nervous because I didn't want to fail. And I didn't know. I felt like I wasn't ready. But I had spoken to Angela's mom, and she told me, she said, you have the heart for this. You're a beautiful person. You're smart. You know what to do. You've done it before. The board is behind you. They've done it before. You
Hmm.
guys know what to do.
Hmm.
You know. Um, I had two dreams about Angela. She came to me twice. The first dream, we were shopping in a big shopping area, and and in the shopping area was a whole bunch of fish market. And I said, Angela, do you want to go to this market? She said, no, let's go to this one. In her bossy voice, I remember. And then the guy at the fish market reached over and gave us three lobsters, and he had them held in his hand like this, and just put it over the counter. So he gave us the lobsters, and We walked away, and then I woke up. When I went to work, I looked it up, and looked up what it meant. What does it mean when you dream about lobsters? And it meant, what it meant was you have just been put in a new position of power.
Mm.
And,
Mm.
yeah, and to stand your ground
Mm.
and to be strong,
All
and
right.
that you will succeed.
Mm-hmm.
So
Mm.
I knew that message was from Angela,
Wow.
you know.
Mm.
And yeah, in a second dream, not too long ago, she was sitting at a table, and she looked so beautiful and serene and just comfortable. And I sat up across from her, and all I said was, I said, Angela. And she said, I know, I know. And I said, I miss you so, so much. And she said, I know you do. And then I said, well, you left me here with, for kidney's sake, like you left me here to just deal with this. And she started laughing. And she said, I said, they say that you groomed me for this. She said, I did. Weren't you paying attention?
Mm.
And I said, yeah, but, and then I just woke up. So, I am comfortable now. I know what I want to do. I know what I have to do.
There you go.
Um, and I'm just ready to do it.
Now, Don, one thing I wanted to ask, you mentioned post that you worked at a clinic.
Yeah, I
Do you
work
work at a
at,
dialysis clinic?
yes, I do. I work at a dialysis unit. Yeah.
Okay, so my question is, what is the biggest challenge or problems you see dialysis facility facing patients on in-center dialysis? What's the biggest issue now
Um,
that you're working on the other side?
housing,
Housing?
depression, and housing. There are a lot of
Well,
dialysis
no,
patients.
no. I mean in center. I mean in
Yeah,
center.
yeah. Oh, you mean like as far as
In center
the staff, how
treatment.
they're treated?
Treatment related?
Um,
Exactly. Treatment related.
um, they
I mean,
patients
are
really.
there
Go ahead. I'm sorry.
no, I was just gonna say, I mean, like the unit where you're at, I mean, not just where you're at, so I don't want to put your clinic on blast, but
Yeah, that's
have
what
you
I'm
just
trying.
noted in many clinics any issues with infection control, patient safety, um, late start, staff shortages? Is any of that
Yes,
prevalent up in New York or any of the
yes,
facilities there?
yes. Late starts, um, shortages. I noticed they have a lot of young, very young techs and nurses coming in, and um, I'm trying to be as. I don't. Some of them are not as experienced, and it makes the patients nervous.
What do you
You
think,
know.
Tamika? Because you're still active in working from time to time.
I agree with her. There are a lot of young, but it's always been young people in dialysis. They just grow up in dialysis. It's just a different type of young people. Like I was like,
Different generation, huh?
yeah, I was 20 when I started working in dialysis. So I was one of those young people, and I grew up in
Mm-hmm.
dialysis. So everything that you see, I was at,
Right. Wow.
inexperience, impatience, in the treatment because I want to get out of there. I was that, but you grow,
Mm-hmm.
you know.
They,
Don Edwards, you mentioned that you stepped away and went to home dialysis because you weren't
Oh,
comfortable in the unit.
oh, I had had enough.
Mm-hmm.
I was tired of not feeling good after treatment. I was tired of the conditions of the dialysis center. I saw things that I really should not have been seeing as a patient, as far as like infection control, like some out of order things, took place, and I didn't feel safe.
Mm-hmm.
Um, I knew that in order for me to get in control of my life, and in order for to get in control of my treatment, I had to go home, because I know when I know that I wash my hands. I know that I change my gloves, and I know that I put my mask on. But I don't mean any offense to any tech or nurse, because I know people come to
No,
do their job and all of that. But I don't know what you did when you came out of the bathroom.
and
We're
you know
not
what,
privy.
Jordan?
As a patient, we're not privy to see that. And I got MRSA
Mhm.
through my catheter,
Yeah.
in outpatient dialysis, and that almost took me out of here. And I just can't take chances like that anymore. So I have to be responsible for myself.
Mhm. You
Mm-hmm.
know what, Dawn? I actually agree with you because a lot of times when we come from out the back and we do wash our hands or whatever, but we come from out the back, sometimes we forget once we get in the unit and wash our hands. So we're
Right.
coming out the back and we're just throwing on some gloves. You get what I'm saying?
Right.
So I do understand you with that.
Right.
Yeah.
I
I,
want to
I,
add on one more person, and after that, Dawson. I want to know what's the future for kidney sakes, and if y'all have any events coming up, so we could broadcast it to get the word out. So let me bring on Kidney Warrior.
Five.
Huh?
I said 5 people?
Yeah.
That's what's
There you go, Alex.
What's going
There you
on,
go.
everybody?
it's a party.
It is a
Yeah.
party.
What's going on, Alex? How you doing?
I'm doing well, and how are you all
look at
doing?
my
Hey, how you
friend Nelly.
doing?
All
What's
right.
going
Thanks
on,
for
guys?
joining us, Alex.
Yeah,
Um,
hey.
recently got out the hospital, been in for a week. But before you share that experience,
Sure.
Alex,
Yeah.
Dawson, what's the future for kidney's sake now? Have you officially taken over?
Yes.
Okay.
Okay, so what's the future? Any plans coming up?
Yes. Well, we've already had a toy drive.
Oh, okay,
We already had
awesome.
a toy drive at a dialysis center. We gave toys to the children and grandchildren of dialysis patients for
Oh,
Christmas.
That's
That's
all.
great.
nice.
That's really
Yeah.
good. That's
Nice.
awesome.
Yeah. So the patients were really happy about that. Um, we do have a game night coming up sometime in April. It's
Okay,
pocketbook bingo. We're still looking for a venue for that. Um, we are still working. We're working. We're starting to work on our Pink and Pearls event. Even though it's in the summertime, we're starting to work on that now. The future for kidney's sake, we want to make change. We want to make changes. We want more people to know about kidney disease. When you go to the store and they ask you, um, do you want to donate to St. Jude or this
mm-hmm.
and that? There's
Hmm.
no kidney.
Nah, it's so
There's
true.
no donation for kidney disease. So, I feel like I want to take it to the top, because people really have to know about kidney disease because it's a serious disease, you know.
It really is.
Um,
Right.
it really is. It's killing people,
Hmm.
you know.
I
So,
think, can I speak to that a second, Dawn, if you don't
Sure.
mind? I mean, something I want to kind of, in that, with what you're saying there, I've kind of been talking about this in the work I do in
Can you
Kentucky.
guys hear
You
him?
know, can you hear, what's
Yes.
that? Can you
yeah,
hear me?
I
Yes.
hear you.
Okay, yeah. So in Kentucky, with what I'm doing with the University of Kentucky and my patient advocacy, the biggest struggle is to kind of it's putting kidney to the forefront, because I mean you got people with kidney with breast cancer and other chronic conditions, and they for whatever reason have the funding better and have like the wear the pink for football players and like you mentioned the St. Jude stuff, Dawn. I think it's how do we change that paradigm shift and change that to make it kidney related and kind of get that same thing. But people don't see that, you get, I've been talking to a lot of other warriors and I hear a lot of conversation about, well, you don't look sick. We don't look it. And so people with cancer, I mean, unfortunately, people with chemotherapy and stuff like that, you kind of physically see something. But with kidney disease, it's a silent killer. We all know that. I mean, I'm talking to, we're preaching to the choir here in this group. But like, I mean, you don't think about it. We walk around and we have dialysis as a fallback option in some people's eyes. And I think that needs to be kind of flipped on its side as well. And hopefully we'll start to see some stuff in the coming years with that.
Right. So Don, you have your team together. Did you do any restructuring or reorganization, or you still using the same team that Angela used?
Oh, we have the same family.
Awesome.
Angela she couldn't have put together the best team, the best people. She always said she picked her team members, picked her board like she would pick fruit.
Mm-hmm.
And she put together the most amazing people. And I always tell them, they're the most important people in the board, because Marcus and I are the only two people on the board that have kidney disease. Nobody else on the board has kidney disease. So they're doing this from their heart.
That's cool.
So they're amazing people, and I'm so lucky that I have them, because they really have my back, and we're a family. We mourn together. We've been through everything together. So I'm leaving it just as is.
Mm-hmm. So Dawn, let me ask you another question. Someone who may be watching now who recently been diagnosed with kidney disease or just started dialysis, and they just don't know where to turn, and they're watching this show and they want to start something to raise awareness or do something similar, what would you suggest to them?
I would suggest that you find that one person that you trust and that has the same idea that you have and has the same goal as you have. A champion. And start advocating. You start advocating. And then you have people, you have for kidney sake, you could call us. You have so many resources out there. The NKF, AKF, CKD champions. And you just call people and you just ask questions and you just advocate. And after a while it grows and it grows and it grows. Because, we started off, just not knowing what we were gonna do, and then Angela just took off. Angela always said, I know how to beg. I'm good at begging. So you just have to call people and ask, listen, I need help with this, I need help with that, and then people will help. They'll help.
Wow.
One thing you got to do, though, I learned from experience, is you got to get out there and network. You got to meet people. You got to touch base with this one and that one. So this way, when you get ready to have something, you have people that you can call on, that can be a resource to you, because it is so hard when you're trying to get out there and do something and draw in people and you're by yourself. You really gotta have people who are willing to help, who are willing to to put themselves out there and volunteer their time and their efforts, as well as their resources. I'm sorry about the camera.
Oh, that's all right.
And it really takes a lot of hands to put these functions together. Like Dawn was saying, the Pink and Pearls event, you got to start now for August, because it takes like 6 months or so to really put to put these things together, and especially when you only have a few hands. So if anybody wants to do anything, my first advice is to get involved with your ESRD network, some other organizations, get to meet people, go visit dialysis centers, talk to people. You got to get out there.
You haven't, Dawn. You put it spot on, Dawn. I mean, Dawn, spot on. With what I do in Kentucky, same thing. I mean, we have a couple of events coming up. We have one at the end of this month. We're doing a kind of a local. The National Kidney Foundation does a big give. 4-hour training. And so we've been working on doing that. We started that back in like October, November. Start getting speakers and start getting like just all the logistical things. I mean, to get them off the ground, it takes forever to really solidify people. It just takes a long time. Especially when you're talking surgeons and nephrologists and stuff like that, because they have their work, everyday work, for them to kind of step out of their daily clinics and then to come back and have to commit to it. It takes a while.
Mm-hmm. Dawn, I want to ask you another question. Dawn Dawson, what's your biggest fear moving forward, or is there any fear being the new CEO of this for kidney sake?
For them to kind of step out of their.
What do you think may be your biggest?
I don't really either challenge or fear, because
both.
I think the biggest challenge is to get more patients involved. It's really hard to get these patients out.
You're right.
It's really hard, and that's
I
the
agree
biggest
with you.
challenge. My fear is my fear for all warriors. I'm afraid of the fact that there's dialysis units popping up all over the place. I'm fearful for all these new dialysis patients coming in, and they're coming in younger and younger. Those are my fears.
Wow.
And I want to be able to help everybody that I can. We have our youth coordinator. Marcus is our youth coordinator, and one of the things that we want to do is get the youth, because those are the people that need to hear this. Because in my 20s, if I had known what I know now, I wouldn't have been drinking so much soda. I wouldn't be eating so much popcorn, potato chips, and candy. So they need to know now what happens. When we went to a high school and Marcus spoke, because Marcus started dialysis at 15. So when he spoke to kids, when he finished, they had so many questions.
Wow.
So one of the things that we want to do is we want to, because I'm so afraid that more and more young people are going to come in starting dialysis. That really, really bothers me. Bothers me a lot.
Wow. Now, Alex,
Yep.
Dawn Edwards mentioned that more people need to get out and network, and I know that's something that you do continuously. Constantly see your short video podcast when you're at the different facilities advocating for transplant.
Right.
Your last hospitalization, how much did that knock you back or set you back with your networking, or did it set you back with your networking?
It actually, I've been home now 2 weeks. I was in the hospital a total of 2 weeks. And so I've been home about 2.5 weeks. I don't think it has really stopped, honestly. As a matter of fact, I've been invited to 2 new events in 2020. In July, I'm going to be in Nashville doing a co-panel with another patient who is with the IgA Foundation. That's the disease that killed my kidney. And so they've invited me to kind of speak about being a kidney patient who kind of works in the field outside of, but not necessarily clinically. I do more outreach. So I'm more just kind of like boots on the ground, talking to patients and talking to nephrologists and all that kind of stuff regarding transplant. But I also talk about dialysis and kidney and just kidney disease in general. And then in August, I've been invited to be on a panel with the University of Washington and the kidney. I'm trying to figure out what it's called, the Kidney Research Institute. They're doing an ideas symposium at the end of August, early September. And so it hasn't stopped really. I mean, I was sick, and I've been invited to kind of go to these 2 events and still speak and share my story and talk about what I'm doing in Kentucky.
Yeah, let me just say, you look amazing because when you
Thank
first
you.
got out the hospital,
Yeah, I was swollen.
you were swollen. I'm looking at you now. I'm like, damn,
Thank you.
you look, man, like you weren't in the hospital.
Oh, that's very kind of you. Thank you
So
very
help
much.
No,
Yeah, no.
seriously.
Thank you.
I saw your video when you came out,
That was pretty. Yeah.
and
Oh, I know.
man, you look. I just wanted to let you know you look amazing, man.
Thank you. Thank you
Yeah.
very much. Yeah, I know prednisone will do that to you. You know, we all know that. I mean, all that, that's what I was on
Fatten
for.
you up.
And Don Edwards. I didn't
Yeah.
mean to cut you off,
Go
Alex,
ahead.
but Don Edwards, as Alex mentioned, he's going to these different seminars, and you do something similar as well. Matter of fact, you're supposed to be in the nation's capital coming up soon, correct?
Oh my gosh, I'm just traveling all over the place, Steve. Next week, I'm going to be in New York speaking at the New York Academy of Medicine. We're going to be, I'll be part of a panel discussion on racial disparities and kidney disease. So I'm really, really excited about this. It's going to be an all-day symposium, and they're going to be talking about all of the different types of healthcare disparities that take place within the kidney disease community. So I'm really interested in that. I want to speak up about that because we talk about this all the time in our neighborhoods that the dialysis centers are all over the place and the food deserts and all of the problems that we faced
Mhm.
in the inner city, and I'm hyped about that. So that's coming up next week. And then I'll be coming down to Bethesda. I'm
Mm-hmm.
participating in an opioid study work group,
Cool.
where it's actually a government granted project where they're looking at patient with kidney disease use of opioids for pain relief and trying to see if alternate methods are more effective and how to reduce the use of opioids in ESRD.
Hmm.
So that's a really good work group that just started up a couple of months ago. I'm excited about that as well.
Mm-hmm.
And then later in February, I'll be coming back to DC for the CMS Quality Conference that's going to be in Baltimore. I'm going to be part of a home dialysis panel discussion at the quality conference. So I'm just really pushing it, trying to get out there and, get this home dialysis thing going. Get the awareness out there. Anything that has to do with kidney disease. If they ask me to speak, I'm coming and I'm talking. That's
Yeah.
it.
Mm-hmm.
I totally feel you on that one, Don. Yeah, exactly. If I'm invited, I'm gonna try my best to get there.
Right.
Totally.
Tamika, um, as you sit here, we celebrate the anniversary today, but did you ever imagine us, talking to three kidney warriors, uh, very professional people, doing something to make a difference in the kidney world when we started? Would you have imagined this day?
I didn't think far with it. It was just the moment, like just taking it moment by moment, not thinking too far ahead of ourselves, just being patient for what God has in store for us.
Mm-hmm. Mm-hmm.
So
Don Edwards, you known us about a year as far as being with us. You're still affiliated with us. What has this year been to you far as urban health outreach media and kidney disease information and just the whole kidney disease community on Facebook in itself? I mean, it's big because you had these multiple groups that have they're private, you can't get in, so you really don't know what's going on. But what you do see in the public realm of kidney disease on Facebook, what has this year? Has it been any different in 2019 far as education? especially with us, Urban Health Outreach Media, and the type of shows that we did throughout the year?
I definitely see how urban health outreach media has grown. I've seen where you might not have um, as many shows this year going forward as you did in the last year, but the quality and the quantity of what it is that you're putting out this valid information that these patients need.
Mm-hmm.
And it doesn't matter whether you can't get into this group or you can't get into that group or this they don't want your posts on there or whatever. What you're doing is absolutely essential and it's necessary to the
Very.
people that are watching it. You
Mm-hmm.
know, it's like going to church. You can't make them come in, but you
Right.
know what you're doing is valid. You know that you're doing what needs to be done.
Right.
And when you continue to do what it is that you're doing, you're giving these patients the information that they need so they know what to look out for when they go to the dialysis centers. You're giving them information on how to take care of themselves, manage their diseases. Your efforts are tireless, Steve. And I just love and respect you and Tamika and the rest of Urban Health. I mean, I love you guys so much because everybody is doing this out of the goodness of their heart. Nobody's getting no paychecks. We don't have no studios and no driving no Lexuses and all of that. Everybody's doing this because we want kidney disease patients to be healthy. We want them to live longer. We want them to share this information. We want to spread awareness. That's what it's all about. It's a
Mm-hmm.
passionate job and it's a non
Mm-hmm.
paying job,
And it's a
you know,
thankless
and we never
job.
get tired.
Thankless.
We
Yeah.
never
Mm-hmm.
give up.
It's
Right.
So
very thankless.
I see growth in 2020 for urban health. I see growth for all of us because we're getting ready to just bust this thing down. I'm telling you, all
Mm-hmm.
of us in all our respective areas, we all got the fire and the drive, and
Mm-hmm.
I just think that this is our time right now.
Mm-hmm.
Oh
And
yeah.
if I may say, Alex Barrios, I was fortunate enough to meet Alex twice in Washington, D.C. when he came down. And
Yep.
he's been a big supporter from day one. I mean,
Yeah.
I just remember your post, from Louisville, and you shared that you was
Yeah.
doing dialysis as far as a technician.
I was.
You actually went through the training.
I did. I did. It wasn't for me. I found out pretty quickly, but yeah, I went through it, and I knew that just as a work in regards to a career, I found that it was thankless as well. I mean, there was a lot of the term "eating your young," like the techs just kind of throw you to the wolves, and you have to learn how to string machines and put on people in a particular time, and the turnaround. Just I found pretty quickly it wasn't a skill set I had, and but I knew I wanted to work in this field, and
Mm-hmm.
I kept on networking, and like I said, that's how we kind of started. Yeah, I just kind of finished at DaVita, and you and I connected, and it's been a great platform for everybody. I mean,
Mm-hmm.
all the different speakers you've had, and I think like the education you bring and all the different shows you had over this last year, all I think served a purpose. I mean, I know they're not, some of them aren't showing now this year, but coming up, but they've all, I've gone back and looked at some old ones, and it's been really, really beneficial. Really,
Right.
really.
You know what, Alex?
Oh, go ahead.
Something called reason, season, lifetime.
Yeah. Oh yeah.
Everything in life has a reason, a season, and a lifetime. So,
Mm-hmm.
you know,
Mm-hmm.
Don Dawson,
Yes.
your husband, he was a dialysis tech.
Yes.
How long did he work in the field?
14 years.
And that's how y'all met?
Yes.
Right on.
Now, once you met, did you have to separate and go to another unit, or y'all stayed at the same unit?
Um, we stayed at the same unit. We didn't have to separate because I mean nobody really knew. I left because I changed units. Came to the unit in the Bronx because I wanted a different doctor. But
Okay.
we stayed.
Wow.
you know what, Steve? I think a way for kidney disease to really get on the main platform is if all of the organizations that deal with kidney disease have the same campaign. And the campaign would be I have kidney disease. And what it would be is a video of people stating that they have kidney disease. And it goes viral that all these different organizations have these videos, and there's not one of the same people in these videos stating that they have kidney disease.
Mm-hmm. It's a good idea.
I've seen other programs.
I've seen other programs do something similar to it, like do a storytelling where they've had patients kind of share their story. It's been out. I've seen it out west in California, like UCLA. But it's like, again, it's like trying to get everybody to do it.
Right.
Would be the point. I mean, I've seen similar stuff.
Right. And it's not even their story. It's just saying I have kidney. It's kind of like Michael Jackson video Black or White, where he changed faces or whatever.
Oh, I see what you're saying.
Everyone is up there saying, I have kidney disease. I have kidney disease. And it's different faces and all these different people, but none of them are the same because the different organizations are catching the people from their community. You know, and so you have all these faces and none of them are the same, you know, and they all have kidney disease. Wake up, America. You know, wake up.
Yeah, that's good. I like that. That's a good idea.
Right.
So create that.
Don Dawson, how long have you had your transplant?
8 years.
Don, how long have you had your transplant?
8 years. Can you hear me?
Can you hear me, Don?
I hear you. 8 years.
You said 10?
8.
Yes.
She said 8.
8 years.
Oh, 8?
Yes.
Oh, okay. And Don, you had a transplant before yourself, Don Edwards.
Yes, I had one in 2003. It lasted 6 years, and then I had a chronic rejection, and I went back on dialysis in 2010.
Now, we did mention that you were doing home dialysis. How beneficial has that been for you?
Oh my gosh. I guess that's why I'm such a spokesperson for home dialysis, because it's made such a big difference in the way that I feel and my life. I feel better doing home hemodialysis than I did with the transplant. And I don't want to, talk bad about transplant because everybody's experience is different. It just wasn't, it just didn't work for me. However, I was sick a lot with my transplant, but with the home dialysis, I know how I'm going to feel every day. I'm doing everything myself. I feel good, and I'm just so on fire for home dialysis, because I mean I'm able to get up and go to work in the mornings now, and that's something that I just wasn't able to do. And honestly, it's something that I felt like was taken away from me by kidney disease. I had a great job. I was working at the post office. Actually, I would have been retiring from the post office this year had I not gone on disability. And yeah, and I had this opportunity before, back then in the 90s when I started dialysis. I might not have had to go on disability. So I just want to put that out there for people that want to keep their jobs, and don't want to make $1,200 a month and try to live off of that, that want to keep their job and their benefits and everything. Home dialysis, I mean, you just feel so much better. As a result, you're able to get out there, and you're able to continue your life. So it's a real opportunity for us. It's a lot of work. I'm not gonna lie and say it's one, two, three, but everything is a lot of work. A transplant is a lot of work. Going to dialysis and sitting up in there half of the day is a lot of work. But my payoff is absolutely is fantastic.
I think each one of them has their pros and cons, as far as the transplant, as far as home hemo, as far as
Of
hemo.
course.
Yeah,
it's a treatment for a disease. So
right,
it's nothing going to be perfect. You just got to find the one that's right for you.
Right, but I do agree with you, Dawn. I do agree more patients should be home doing it. They'll feel more comfortable. They'll be in more control of their treatment, and then they'll be more in control of their health because they're more aware.
Mm-hmm.
Oh my gosh, you just so aware. I'm just so
Don
in
Dawson,
tune
did
with
you do home
Yeah.
myself.
dialysis?
No.
Did you ever want to or think about it?
Oh, you
Um, you
didn't?
know, when I started dialysis, I I didn't have a lot of information.
Hmm.
When I started, they gave me this
Yep.
paperwork and they had, my different options, but you know, like at that time there wasn't an ongoing education like there is now. They just give you
Right.
the paperwork, you look at it, you choose what you want to do, and then you're on dialysis.
Hmm.
You
Hmm.
know, so I just did, and sent a hemo. You
Okay.
know.
And you know what? Unfortunately, it's still like that. When new when
Hmm.
when new patients come in at my clinic, I kind of like sit next to them and break everything down to them and let them know
Hmm.
they have choices.
Yeah.
Yep.
Yeah.
Like they have choices. And I asked them, how long has this been going on? Some patients had a fistula for 3 years, and I'm like, well, why haven't you gotten a transplant list?
Hmm.
Oh, I didn't know. I said, so you let someone put something in your arm and you don't ask if there are any other alternatives?
Oh my God.
Discouraging. Ugh.
Yeah.
See,
It's a
see,
scary
that's
thing.
Yeah.
It's a
mm,
scary thing when you are diagnosed with kidney disease and they tell you that you have to start dialysis. You think you're gonna die. You
Yes.
know what I mean? So, I mean, I, I, I don't think at that time you're really thinking about asking any questions. You just like, okay, how am I going to survive? What do I have to do to live?
Right.
Maybe later on,
Right.
you'll start asking questions. But the good thing is now, like I said, we have more organizations that can give you more information. You know, God forbid I go back on dialysis. I plan on doing home hemo. You know,
I, I think
so.
I think more of the organizations need to get in center. Because
agreed.
I don't see, and I'm just saying because I work in dialysis and I go to different units, I
Mhm.
don't see these organizations in the unit. You get what I'm saying? And I
Well,
No, they
we
don't.
do.
I
We do.
think
We do lobby days at different dialysis units.
right, that's in New York. I'm not from New York. I wish I
Yeah.
was, to see what y'all do because y'all do a lot versus in
Yeah.
here, nothing. Nothing at all is really done for the patients.
Same here in DC and
So I
Baltimore.
truly admire what y'all do in New York. Like I really do. I really wish I could take pieces and like bring it down here so they can see something different. Like how y'all have award ceremonies or even information ceremonies for the patients. They
Yeah.
don't have it like that.
I ain't never seen nothing like that down in
No,
Baltimore.
no, they
You
don't
need
have
to
it like
come.
that here.
You guys need to come to
Alex,
our awards
come
dinner in November. November 8th. You need to come.
on.
Yeah. What's up, Steve?
All of you.
Yeah. What
But
took my
that's
Alex, what information do you discuss with patients when you go to these facilities?
So when I do my lobby days, I mean, it's generally a kind of a big overview of kind of what they should expect, like giving them options, saying, kind of meeting them where they're at. Because I get patients who are been on dialysis for 10 years. I got people who are on dialysis for 3 months. So I have to kind of meet them where they are. The information I give them is kind of about living donation, paired exchange, obviously the transplant kind of process, who they're going to kind of talk to when they get that referral, how to kind of trigger a referral with their nephrologist, who they're going to talk to at their respective transplant center, kind of expect kind of what kind of labs they could, not labs necessarily, but kind of like what they could, expect to see and what kind of testing they might have to go through, and just let them know that if they have questions along that journey, that I'm going to be with them as they go through that. So like I'll talk with once the referral is triggered, I'll try to have that conversation with not only the dialysis social worker, but obviously my team as well, and just be like, all right, so Mr. Smith has gotten referred. Let's see what's the next step, and then kind of keep in touch with that patient directly or their caregiver to kind of make sure that they're not getting lost in the shuffle. Because of what I found in this last year in this role, I've only been in a year and a half, and the biggest thing that I find that's a barrier is that the dialysis centers and the transplant centers just don't talk to each other. There's like they do because there's certain quality things they have to kind of meet, but it's very minimal. And so I try to kind of be the intermediary to be like, all right, so dialysis center A needs to talk with my transplant center, and then we just need to kind of keep that dialogue going. So I kind of am the kind of conduit, because I think, our coordinators have, 500 people sometimes between the three of them on a wait list that they're just having to wait to. So if I can kind of help kind of ease some of the stuff that they have to not have to do, to then keep, patient engagement, right? You think about like talking to patients about, keeping them in the loop through things, because I think things sometimes fall through the cracks. So, that's kind of the stuff.
Don Dawson, what do y'all discuss during your lobby days? Same thing, or y'all come with a different approach?
Well, we have some educational information that we get from the NKF, about fistulas and about infection control and things of that nature.
Mm-hmm.
And we have flyers for our future events. We tell them about For Kidney's Sake. Sometimes we have somebody to come with us and speak to the patients. It could be maybe a therapist that may answer questions.
Absolutely.
Things like that. We try to have a therapist at least one of our events, to talk to patients about mental health.
That's very important. Very important.
Yes, it is. It really is.
Go ahead, Tamika.
No, I was just talking to my boss the other day and asking her why isn't certain things up there boldly. Like they have the foods up there boldly. Why don't they have mental health help up there boldly? Mm-hmm. There's a lot of patients that's unable to process this disease, so they stop living, and they begin dying.
Don Edwards, why do you think there's really no focus on mental health in end-stage renal disease patients?
I think because it's just not a part of kidney care. I think that the dialysis centers are focused on just rendering these dialysis services, keeping that access flowing so that they can put those lines in there and do the dialysis services. It requires more manpower, more money, and they're not putting that out there. It's not a part of kidney care.
But it's
just like if you got hemorrhoids, they're gonna send you somewhere else.
Right.
They're not gonna address that in dialysis. If you got a toothache, you gotta go to the dentist. They're just not they're not dealing with the total patient. They're dealing with your kidney disease, dialysis, and that's all you get. That's what's in the bundled payment, and that's what you getting. You got 3.5 hours and keep it moving.
Yep.
Wow.
No,
you really straight to the point.
Can I speak to it? What's interesting as a technician when I work.
But that's that's what it is, and that's where and I hate to say it like this, but we patients, we gotta empower ourselves.
Yeah.
And we gotta learn about this disease and recognize when something is going on with us that's not right. Be in touch with yourself. Get on the phone, call a friend. Go out, get on Facebook and share urban health outreach media. Watch these things so that you can learn about this disease, because it affects more than just your kidneys. You got heart issues, you got bone issues, your muscles, your teeth. Everything is affected by this disease.
Exactly.
Everything is affected by this disease. You can't just go to dialysis and think that's it.
So true.
And for women, you got your GYN issues. Oh my gosh, I feel for young women on dialysis. What happens to us when you're in your 20s and start dialysis? It's just so much to learn, and you gotta.
They don't even address that in the center as far as sexual health on dialysis.
Never.
So you have these 20-year-olds coming on dialysis, and their sexual health has changed, and they don't
Yes.
understand why these things are happening to them, but there's no one
Oh
there
my
to
gosh.
address that. And I think that's just so unfair.
Mm-hmm.
Yeah.
Mm-hmm.
Well,
Yeah.
Tamika, I'm telling you, that's the kind of thing that I'm trying, that I'm really trying to do with the wellness workshops and stuff like that. Let's try to get this information out there so that
Mhm.
people can get it. I started 23, and by the time I was 26, I had to have a hysterectomy because
Mm,
everything
mm,
just went
mm.
absolutely bonkers. And
Sure.
I wanted
Right.
more children and all of that. So this is, these are things that are not addressed. What about erectile dysfunction in the men? Men
Yeah,
don't
it
want to
is.
talk
Mm,
about
mm.
that.
Oh
Everybody
yeah.
want their woody to be, what it's supposed to be. But I
Mm-hmm.
mean, the fact of the matter is, some people just can't,
Right.
and
That's
that's
where.
something
Yeah.
that needs to be dealt with.
Mm-hmm.
Right.
What about dating and intimacy and all of these things?
Mhm.
These
There.
dialysis centers and the social workers are not equipped to deal with all of
No,
these
That is so
issues.
true.
They're
Oh.
just not.
no.
And
And
Alex,
we
what
and
are
we
you
have
going
to
to?
do we have to do it ourselves.
Yeah.
Mhm.
Right.
So let me speak a little bit to so when I
What are you going to say?
yeah, with my visits and when I was training to be a tech, talking to my social workers in Kentucky, I mean, there were some really good ones and there were some average ones. And so the ones that were average, like they just kind of do their surveys to kind of like hit kind of like whatever metric that needs to hit for Medicare or for that dialysis center, and they like ask like very like high end like just quick questions, and then they just go back to the next chair. And so like they don't really truly sit down and have that conversation, or and there's just a lot of moving parts. I think like sometimes there's a rapport issue between patients and
Mhm.
social workers. And there's some social workers who just have it great, who can really have a really good conversation with somebody and kind of unpack some of those things, Tom, that you're talking about. But for the
Mhm.
most part, what I saw, at least in my eyes and my experiences, were that these social workers would just kind of be like, all right, what do we have to do this month, and then just fill out survey and just kind of go through these questionnaires like in 5 to 10 minutes, and not really again get the full picture of the patient. While they're on dialysis, all they have to worry about, like you said, Dawn, is just the dialysis, just to get the lines in and keep it moving. And I think that is definitely doing a disservice to us as patients. I mean, hands down, a huge disservice.
Right.
Right.
And
Don Dawson.
I'm sorry. Go ahead.
No, go ahead, Tamika.
I was going to say, I really think they need to find social workers that can adapt to the culture in the center,
Yeah.
not social workers that come in there with their head raised high and look down on the patients, because they don't tend to help the patients. They tend to make things worse.
Mm-hmm.
Right. And Don Dawson, what's your thought on this? Because you mentioned for kidney's sake, that's one of your main mission is to address depression.
Mhm. It's definitely an epidemic. And, at my unit, I had asked the medical director in a meeting, I said, listen, why don't we have a therapist here? These patients are depressed. And she said, um, well, we don't have the money for that. And that's the bottom line. It's about the money.
Oh yeah.
They're not interested in the patient and what the patient's going through. Like Dawn said, get them on the machine, and that's it. That's their goal. Me being a patient navigator, I tend to yank their chain, because when I walk into that dialysis unit, I'm a patient first.
Mm-hmm.
So, I let them know how it feels. I let them know what the patient's going through, why they're depressed. You're not a person. You're not just on dialysis and that's it. There's other issues going on. You have your mate that might leave you because you're sick. You don't have a place to live. You have multiple comorbidities.
Yeah.
You have all these things to deal with and dialysis.
Mm-hmm.
A lot of these patients need help. Some of these patients think that I'm a therapist, because they don't have anybody to talk to that's going to understand and listen.
Mm-hmm.
So me being a navigator, they come to my office and they just let loose. And the funny thing is, the men come in office and cry more than the women do because it's hard. It's really hard. And I talk to the social worker all the time, and I say, you know what, this person needs to see a therapist. And ask, they ask, they say, is there a way that I can see a therapist? And the social worker will send them somewhere else where
Wow.
they end up not wanting to even go. So
Mm.
they're really not interested, and it's very sad. And there's but so much I can do. I try my best to change. They have made a couple of changes. You know, they had
Right.
customer service training, empathy training.
There you go.
You know,
You gotta start
so
somewhere. You gotta at
Thank
least you
you.
started somewhere.
yeah,
That's good. That's something.
yeah.
Yes,
So
they need that empathy training, especially the technicians. I didn't begin to truly care about my job until my son got sick.
Mhm.
That's when everything changed, and I probably was working in the field maybe a year, and I didn't know how to do blood pressures, so I would fake a blood pressure. And I'm just being brutally honest, because there's others like that don't know how to do a true blood pressure. They depend on the machine, especially when you're being trained off the street. So
Exactly.
I was trained off the street. So I just walked in and said, do you want to be a dialysis technician or do you want to be a secretary? I said, which one pays more? They said, the tech does
Wow.
more. Just because I had nursing background, all I was doing was prerequisites. I wasn't in any program. I was just on my prereqs. That's it.
Mm-hmm.
So I got
Hmm.
I got my training. Never trained me on blood pressures. They just taught me how to cannulate. That was it. So everything else was literally on the job training. That's it. How to
Right.
all that was on the job training. And if I didn't stop working in dialysis after my son got sick because I couldn't take it mentally, and I became a medical assistant, that also helped me do my job better because they still wasn't training on what to do, especially being having sympathy for the patients and not getting an attitude with them because they're having a bad day. I
Hmm.
think that training for that also needs to actually happen in the centers for the simple fact is it's not even about you when they walk in there. They're trying to get their treatment. They're trying to not be hurt by this needle. They're trying to feel halfway decent to be able to go home to make a meal for themselves. But
Yeah.
sometimes the technicians, the nurses, the staff period take it a little personal when
Hmm.
a patient says something. So then you have this quarrel that's unnecessary when if it's some type of training to help them see from the patient's eyes versus from what they think is truly going on.
Right. Now, Don Edwards, when you was just talking, you mentioned a whole litany of problems and issues that many warriors face day to day. Now, when you multiply that times more than 7,000 units, and you don't have any organizations addressing these type of issues that you mentioned, problems dating, erectile dysfunction, uh, and other uh, issues or symptoms derived from kidney disease, and no one's talking about it. But these are shows that we discuss, issues that we discuss right here on Urban Health Outreach Meetings. I mean, how important is it to discuss these issues that people don't want to talk about and keep to themselves, just thinking that they're the only ones dealing with these problems that you mentioned? In fact, that there's many people that's dealing with them, but they're just not talking about it. How important are these type of shows that you discussed need to be done? Are you there, Don?
Oh, who you talking to?
Don Edwards.
Oh my gosh. Yeah, yeah, I heard everything that you said. I heard everything that you said. Oh my goodness. Yeah, I mean, all of these things are vital to a patient's quality of life, Steve. I mean, when we're talking about treating, you're talking about treating a disease, and then you're revolving that treatment around financial issues, and then we're introducing all kinds of other things, other variables into the picture. How is this patient supposed to have a some type of quality of life when all of the issues aren't being addressed? It's like putting a band-aid on a hemorrhage. It's not going to work. So in my opinion, more resources are needed, and it doesn't necessarily have to be more money. I mean, the people that we have just need to be doing a little bit more, maybe, or a little bit more effective jobs. Like our social workers need to maybe coordinate mental health a little bit better, or
Mhm.
our dialysis centers should be linked up with mental health centers, whereas the patients can be referred to people in the mental health field, and they see the people and they feel comfortable, because nobody's going to sit down and tell all of their problems to a virtual stranger anyway.
Mm-hmm.
So these things that we need, and I see this on CMS all the time. They're talking about coordinated care and patient-centered care, and patient centered everything. So if we're going to be truly patient centered and we're going to provide coordinated care, then the resources that the patients need outside of the dialysis spectrum need to be addressed. And that's
Mm-hmm.
only going to help them in the outrun, because if they're getting fee per performance now, which I see on CMS all the time, they're getting paid for the quality of the services that they render. So the better the patient feels, the more money that they're going to be able to get. So then they need to be
Mhm.
addressing all of these issues so the patients can have a better quality of life, they can feel better, and they can get more on their reimbursements. Let's pull it together.
Just
Mm-hmm.
get all the voices at
Mm-hmm.
the table. Get all. I mean, yeah, Don. I think it's so true. I mean, get
Right.
everybody, get mental health. I mean, it's we said earlier about the whole, these our dialysis patients have so many other underlying issues, comorbidities, different things. I think, why doesn't a dialysis center bring mental health? Why don't they try to bring in some dental or something? I mean, it would just that almost just makes sense. I mean, it costs up the business model. It seems to, should, you mentioned that pay for fee. Like, I think there should be some incentives or something to help bring the patient, to give them that best quality of life that they need. I mean, I think it's what it comes down to.
And Don Edwards, one question: how important
Uh-huh.
is education and shows like Urban Reno Talk with Tamika and Steve and Warriors Quest?
I'm sorry, dear, I didn't hear you.
I said, being that education is very important with kidney disease, patient education, how important are shows like Urban Reno Talk with Tamika and Steve and Warriors Quest?
Oh my gosh. I I think that we should have things like this in every dialysis center. I say this all the time. I talk to, people in the dialysis field all the time about this. Education should be a part um of every dialysis session. Just like when you go to the hospital, they have that education station that you can opt to turn on. I think that this dialysis journey is so crucial. Until in the waiting room, they should not be showing Maury and and all of these shows and stuff like that. They should be showing treatment options, education, things like that. And they
I
should
agree.
absolutely have an education channel automatically synced into those televisions in the
Mm-hmm.
Mhm.
dialysis center.
Yeah.
It's this is all about patients getting information to take
Hmm.
better care of themselves, and it's only going to profit the facility in the long run.
Right.
Patients that have no health literacy or have low health literacy or don't understand what they're going through have no control over their disease.
Mm-hmm.
You can't
Mm.
take care
Yep.
of yourself or you can't fight in the dark.
That's
Right.
right.
So
That's
you
right.
got to know what it is that you're dealing with.
Absolutely.
And
And you
I
know,
just, this should be the most important thing to anybody that's giving health care to anyone is educating them about what it is that they got to fight against.
yep. And you know what,
That's
going
what's
to
important.
piggyback on that, I do think that they should also have resources on that TV also, because they have it on some little paper. Half the patients have vision issues. So
Right.
what do you think that they're going to read? And then the other half of the patients can't even read.
Yeah.
So you're giving patients paper and they're illiterate.
And some of them just
And
throw the paper away.
Yeah.
You're not taking the
yeah,
time to read to them because it has medical terminology in it. So then now it makes it even more confusing.
correct. You have to sit down and talk to people. I mean, even webinars and stuff, that's good for the above average
Yeah.
patient
Right.
that can tune into a webinar on the internet. A lot of us advocates attend those webinars and
Yeah.
stuff, and so we can get something out of that. But we advocates, when we watch the webinars, you know what we got to do? Put our boots on
Mm-hmm.
and go into the dialysis center and take that information we learned from the webinars and translate it into
A
the
language.
vernacular in our hood.
That's so
Yep.
true.
That's what
Yes.
we have to do,
Mhm.
Yep.
because the average patient cannot pick up if they have Wi-Fi in the first place,
Yep.
or if they have even if they know how to access the internet and all of
Mm-hmm.
that. I mean, come on. We're
Mhm.
talking about we're talking about breaking things down to the least common denominator here.
Mm.
Yep.
It's very nice to put money into all of this printed material and into these webinars and all of this stuff, but you gotta step up to a person, put your hand on them and say, I understand how you feel. I have
Mm-hmm.
kidney disease too, and
Yeah.
this is what you need to do.
Yep.
You would
Wow.
be
This is what happened to
surprised.
me, and I
Mhm.
don't want it to happen to you.
You
What
would
did you
be
say, Don
surprised.
Dawson?
Yeah.
You would be surprised at how many patients don't know whether they have a graft or fistula in their arm.
Yeah. I've
Oh
seen.
I
yeah.
walk around. I
Yeah.
walk around, and they'll come from getting their arm operated on, and I'll walk over to them and I'll say, "So what's that? Do you have a graft or fistula?" And they'll say, "I don't know."
Wow.
So I have to explain to them what is a graft, what is a fistula, and
Mhm.
so this is your arterial, this is your venous. This on the machine is the artificial kidney. This does it. I explain the whole thing, as much as I can.
Sure.
Sometimes I'm on that floor for 2 hours. You know, every new patient that comes in, I give them a packet when they're ready.
Yep.
I give them a packet of information about transplantation. Um, I give them about your first 3 months on dialysis, what to expect. I give them a whole packet of information. The social worker's like, "Where did you get that?"
Wow.
So education is very, very important because it empowers you.
Mm-hmm.
It gives you a voice. So these people can't just do anything to you.
Exactly.
Mhm.
You
That's what I'm
know?
You
talking
take your
about.
power back.
Yeah. Mhm.
You
You
take
get the
your
power.
power back.
You take the power away. Yeah. The patient is the
That's
power.
what I
Yeah.
want patients to
Mhm.
learn. I don't
Yeah.
want to just don't accept what's given to you.
Yes.
Mhm.
Mhm.
Find out the next
Mhm.
step. I
Mm-hmm.
tell patients
Mhm.
all the time, you wouldn't just buy a car from the first thing the guy on the lot shows you.
Right.
Mhm.
You want to see other things. You want to
Mhm.
try it out, you
Mm-hmm.
know?
Yep.
Yeah.
Ask
Yeah.
questions.
Mhm.
Ask questions. I tell my patients all
Yes.
the time, ask questions. Ask me questions.
There's nothing. There's
Mhm.
nothing wrong. There's no. I don't think there's anything. There's no stupid question. I think
Right.
with our care. I mean, ask anything, and and get the knowledge. Get that knowledge and be able to kind of then
Mhm.
equip yourself to have those tools
Mhm.
to learn about this your disease and what you're going to go through. I mean, I can share a little bit. When I was in the hospital, talking with those nurses and social workers and doctors. I mean, I'm a pretty I consider myself pretty smart and I'm able to kind of carry a good conversation, ask the right questions because I've been through it and in the work I do. So the nurses were taken back because they were like, you are one of our favorite patients because you ask the right questions. You're really introspective. You know about your care. You know what you're doing. And I think I had a conversation with you, Steve, I think about, I probably wasn't the norm. I don't fall under the norm as a patient because I know a lot about my care and what I need to go through. But I want more people to be like myself in that respect. Like I think it'd be good to have a patient, who is willing to ask the right questions and ask the tough questions to your care team on dialysis or in a hospital because of issues like I had.
Mm-hmm. Alex, one question. You go around the different units in Kentucky.
Correct.
And give information.
Mm-hmm.
And I'm sure you receive feedback from a lot of patients. You said you talked to patients been on dialysis 3 months, 10 years.
Right.
What fear about transplant have you heard from patients, or have you heard any patients express fear of receiving a kidney, so they just rather stay on dialysis? Have you ever been faced with that question or with that type of talk?
I have, and unfortunately, it really goes back to what we talked a little bit about, like the health literacy, because I think a lot of people just don't know about what transplant is. They get the information from the social worker, and then they just kind of glance over it, and then they go about it, and they just stay on dialysis. So sometimes I think I've had patients tell me they don't want to have a transplant because they think they're, risk of surgery, they're going to die. Like that's the biggest one. I said, it's very common. Transplant is very, it's very rare. People can die from a transplant. And I think that, I try to kind of help them to kind of understand that, like, would you rather be here 12 hours, 15 hours a week on a machine, or would you rather be with your grandbabies, or would you rather be singing in a choir? Would you rather travel? Those kinds of things. So I kind of help them understand that. So, I do get people who are, I think their biggest barrier about wanting to get a transplant is they think they're going to die. They don't, and then I get the same, but then at the same time, I get people who are on dialysis, who've been on it for years, who are just like, well, this is my lot in life, and I'm not going to make any changes. And that's the most frustrating thing. I was just talking with my boss yesterday about, I was in a part of Kentucky. It was a rural area. It was a rural area that had like one dialysis center in the town. It was a huge unit. I can't remember how many chairs it had, but it was a huge unit in a really small area. And everybody was just like, I don't want to be bothered. I don't want to be burdened with getting a transplant. A couple of, other barriers people face, at least in Kentucky, it's pretty rural here. And so in some parts of the state. And so to get the access, to get the literature, the education, to get to a transplant center can be 3 hours for some folks. And so
wow,
that can be a challenge. That can be, and we have 2 transplant centers in our state, but it still makes it difficult for those folks who live like on the West Virginia side, on the eastern part of the state, or even the people who live out in the western part, like toward like Missouri and stuff. I think they're just set in their ways and they don't want to make their change. They don't want to make that change.
Mm-hmm. Don Dawson, when you hear something like that and you are a transplant recipient, what goes through your mind when you may hear someone say they don't want, even though that's their right, but when you hear talk like that, what goes through your mind?
I ask them why first. And depending on their answer, some of them say, I'm scared. I'm afraid I'm going to die. And, I explained to them the first year I was on dialysis, I didn't go on the transplant list because I was afraid as well. Because you hear so many horror stories. But my main thing is what I tell them, everybody, I'm very spiritual. And I tell them, you have to step out on faith. If your faith in God is strong, then you step out and you take that chance. But some patients are afraid of rejection. They say, well, what am I going to do a transplant for if my kidney's going to reject?
Right.
But transplants are lasting longer and longer these days. Marcus lasted 19 years. I asked my doctor, was mine going to last 19 years like Marcus? He said even longer. if you do what you have to do and you pay attention. You know,
Absolutely.
and I let the patients know that if you do what you have to do and you pay attention and you take that medicine, you don't know how long that kidney's gonna last. You know,
Right.
um, but some of them do get on the list. Most of them do. At my unit, more patients have gotten on a transplant list and gotten transplant since I've been there. You
Oh,
know,
that's
Great news.
awesome.
That's great news.
yeah.
Yeah.
So, but some of them do, and some of them are just comfortable. You know, and I
Right.
try and I try my best, but I don't push. I just respect.
Mm-hmm.
I just
Right.
respect their choice. You know.
Right. But you,
Yeah.
kidney veteran, 29 years, almost 30 years. If you had person who just started dialysis, this their 6 months to a year, come up to you and say to you, I want to get a transplant, but I'm nervous. What would you say to her with your experience in being that you had a transplant and rejected in a short period of time? What kind of information would you give this person, being that you had the transplant, but it lasted under 10 years?
You know what? I always encourage a person to go for that transplant. I don't use my experience, and I'm not jaded, or I don't use my failed transplant as as like a wedge to scare anybody out of trying, because everybody's experience is different, and I have so many friends that are doing well, that got kidney transplants. I got friends that have two and three, have had two and three transplants. So everybody's experience is different, and I always make it a point to tell somebody, don't waste time. If you have somebody that might be a living donor, ask them, see can you get a living donor, and if not, get yourself on the list. Even if you're not sure,
Mm-hmm.
get on the list,
And this is
because
long.
time is pressing.
Mm-hmm.
So you make your decision. When you get that call, your gut is going to tell you, are you going for it, or are you not going for it. But don't wait and waste time thinking about, oh, am I going to be able to pay for the meds after 3 years, or oh, am I going to get cancer, or oh, is listen, you got to go for it. Just like you didn't really have a choice on whether you were going to do dialysis or not. This is another treatment option that we got to treat the same way. If you have a
Mm-hmm.
chance of getting a transplant, that is the best treatment option that's available for kidney disease right now. So if you have
Mm-hmm.
an opportunity to do that, I say go for it, and and just pray that, do everything that you're told and follow the instructions, and just pray that it works out for you, because
Mm-hmm.
you what are you going to do except for be on dialysis? I
Mm-hmm.
mean, if you can try something else that may be helpful to you and give you a better quality of life, then you should. That's what I encourage patients to do.
Right.
Mm-hmm.
Shout out to Lisa Baxter. Her transplant is almost 4 years. But Alex,
Yep.
do you, or is it talked about much when you go around about preemptive transplant? Why is that not mentioned much, especially to African Americans? I mean, I'm not putting you on the
Oh,
spot
sure.
because a lot of African Americans don't know about preemptive transplant,
Mm-hmm.
and they end up getting on dialysis. Uh, they in stage, whatever stage kidney
Yeah.
disease they
Right.
are, and they could get preemptive transplant if they get
It,
on the list before they get dialysis. Why is that not
yeah.
talked about?
Well, we're looking. It's funny you said that, because I think this is the year for us that we're actually starting to push it a little bit. And I'm trying to kind of go to nephrology offices and talk to nephrologists and MAs and things like that to kind of share, that let's have that conversation too. I mean, and obviously, in my unit and with what I'm doing, I'm already visiting patients who are already on dialysis. So I mean, part of my job again is talking to nephrology groups and
Yes, I'll be right back.
nephrologists in early stages and talking to those patients. to just kind of like let them know, hey, like let's look at where these patients are, and if we can kind of talk about living donation early, obviously to get them that kidney, then let's do it. It's something we're in the works to kind of hopefully start pushing preemptive transplants before dialysis. That's we obviously the big picture, we don't want people crashing into dialysis. And so, I'm when I at my clinic here in Louisville, I talked to some patients today, as a matter of fact, who are early stages, but who were interested in transplant. And so they weren't on dialysis yet, but they were interested in wanting to know more about what transplant could look like. So we had that conversation, and it was a good start. So, I mean, I think it's coming. At least from in the circles I'm in here in Kentucky, it's being talked about, and it will be talked about here in the future.
Right, Tamika, what do you think about that preemptive transplant?
I think that's something they should do, period. The moment someone has kidney failure or kidney disease or some type of issue, I think that should be a conversation.
Mm-hmm.
Even as far as when they come in the hospital and acute kidney failure, I think that also should be a conversation. Like I don't think they should wait 2 years while they're on the machine and then want to work them up for their transplant. I think that should be a process already taking place.
Right. What about you, Don Edwards?
Unfortunately, I wasn't able to hear what Alex said. I can't hear him. However, preemptive transplant is a great it's a great thing for people that can get them. The problem with preemptive transplant is in our community, and we know that the amount of kidneys that are available is so limited, and it would be great in our community if there were more available organs so that I could just go to my cousin when I'm in stage 4 and say my kidneys are going, can I get one? The problem with us is it doesn't appear to be really geared towards us because we don't have potential donors. So I
Yeah.
think that further kind of puts our disparity issue in an envelope. There's things that are available in the hood. In better neighborhoods or in better economical situations that are just not available in the hood.
Mm-hmm.
Right.
And preemptive
Absolutely.
transplant,
Mm-hmm.
although it's a wonderful thing, and it's saving lives, I think it's fantastic. And to those who can get one, oh my gosh, that's like a gift from the angels. you know
Yep.
um but when we have this shortage of organs,
Mm-hmm.
and we have people who come from families where everybody's diabetic or everybody has hypertension,
Mm-hmm.
who do you have as a donor?
Right.
Nobody. Nobody. When my son first was diagnosed with kidney disease, he was 18 months. And once they put him on dialysis, they said, we're going to start working him up for a kidney.
Wow.
He was only in the hospital 5 days.
Man.
And he's going to start working
Wow.
up for a kidney.
Mm-hmm.
They said because the
Wow.
kidneys work better when they're younger.
Yeah.
Look at that.
Mm-hmm. And he was 18 months. So we was about to start going through the process, and then his albumin went up, and then his kidneys kicked back in.
Hmm.
Mm-hmm.
Wow.
All right.
Yep. But they was going to start working him up for a kidney. That quick.
Yeah.
It's
Wow.
and see that, well, for and that's, babies. I think babies get transplants probably quicker than
Oh,
grown-ups.
Mm-hmm.
I would
Mm-hmm.
probably think
I
because
think they get
you
more
may
living
have
donors.
more. Uh-huh.
I think
Go
they
ahead,
get more
Tamika.
living donors because their parents, 9 times out of 10,
Do
are.
they put do they put grown people kidneys in little babies? I don't think so.
Mhm. They do.
They do?
Mm-hmm.
Oh. I
Yep.
know they put two baby kidneys inside of grown people, but I thought that grown up kidneys didn't fit inside of infants.
When my cousin was 4 years old, he got his mom kidney.
Hmm.
Yeah, but that's a child. I mean, that's not an
Oh,
infant.
Yeah, well,
Right.
I
But
can't
right,
yeah.
speak on babies. I'm sorry. I'm not sure of the infant babies, but I do know that when my
right, right, right.
he got his mom kidney, he still have it to this day, and he
Wow.
is 30.
Yeah, yeah. I know some people who were children and got their parents' kidneys,
Mm-hmm.
but like the little wee infants.
No,
I'm
I'm
not
not
sure because I
sure.
know that there's some type of anatomical stuff that
Besides,
that
yeah,
works on with that,
besides,
with
yeah.
size and everything. Because I
So
know I have a friend that got two baby kidneys, and he's a grown man.
And they work good, don't they? They good, healthy kidneys.
Oh yeah, oh yeah, he's doing
mhm.
well,
Yeah.
and they just gave him
Oh,
both of
so
them instead of the one.
Oh, they gave
wow.
him both.
No, go
Yes.
ahead.
That's nice.
No, we
So
had
who?
a question
Go ahead.
on my Facebook group watch party from Raquel. She says, "I want to know what are the symptoms or the sign when you are having problem with your kidneys." Anybody want to
I
add?
will. Yeah. I mean, I'll speak to that a little bit. I mean, some of the signs and symptoms you would see would be swelling, would be one. Um, I think you'd probably see. I know for me with my native kidney when it started to fail, there was issues with when you urinate, your the pee that goes hits when it hits the toilet bowl gets really
Foamy.
foamy. It can also smell sometimes. Your breath has a metallic taste to it. Those are some things that I went through with it. Those are the three things that I noticed. I had some swelling, kept on having some migraines and some headaches, and then the foamy pee. That was for me what I
Did
had.
you have any itching?
I didn't actually. I don't remember having any itching. No, but no,
Any fatigue,
I had the fatigue. Yeah, I definitely had the fatigue. Yes.
nausea, and vomiting?
Yeah. Yep. Yep.
Hmm.
Yep.
What about you, Don Dawson? When you first was diagnosed with kidney disease, did you have any symptoms before you actually started dialysis, or
Yeah,
go
yeah,
ahead?
I was nauseous a lot. And I had a lot of fluid at one time. I was so swollen. I had so much fluid that I had congestive heart failure.
Wow,
Oh no.
Yeah, yeah. And then I went to the
wow.
hospital, and I had 60 pounds of fluid on me.
Mm.
Yeah.
Mm,
So
mm.
when they took the fluid off, and they told me that I had nephrotic syndrome, and the doctor at that time was able to keep me off of dialysis by with water pills and blood pressure pills. So my
Hmm.
creatinine went from I think 11 back down to 1.1
Wow.
with the
That's
medication
amazing.
and the high blood pressure and the water pills and I think
Mhm.
potassium something. And what happened was um, I I went back to work. Once I was feeling better, I went back to work. So when you go back to work, they stop your Medicaid. You know, and where I was working, I wasn't making enough money to pay for my medication, and they kept telling me that they were going to give me health insurance, but they weren't giving it. They weren't giving it to me.
Mm.
So I would get my blood pressure medication when I could afford it.
Uh,
So my pressure was spiking up and coming down, spiking up and coming down, and eventually my kidneys just blew out,
uh,
Wow.
You
and
see
that's how
that?
I ended up on dialysis.
mhm.
Mm.
Mhm.
Don Edwards, Michelle, well, Michael Miller says, I would say for me, I am nervous to go to a consultation for a transplant because of my weight and heart issues. I am scared of the rejection of not getting on the list. What would you say to that person?
I
What could
I
you
would
say to her
say
that maybe for her to maybe think about it?
now I would really give that some really deep thought because number one, when you go for a transplant workup, You're going to get the best physical that you ever had in your life.
Yes.
If anything is wrong with you, they're going to find out about it
Mm-hmm.
so that you can do interventions and
Mm-hmm.
treat it and take care of it
Mm-hmm.
now.
Right.
So that's one of the first things. Even if you're not accepted to be in a transplant program at that time, they will tell you what you need to do to get yourself in order so that you can be a candidate. So I wouldn't, let that be my reason for not going for the transplant workup. Second of all, if you do get accepted on the transplant list, now you start accruing time, because right now while you're sitting back thinking about it, time is passing. You're on dialysis, and what happens, especially when you're in center dialysis, you're getting sicker and sicker, whether you realize it or not. When you're on in-center hemodialysis, you start at one level, and you gradually, very subtly and very gradually start to decline in your health. So
Mm-hmm.
if you're gonna go for a transplant and you're gonna go for a transplant workup, you need to go ahead and do that while you're in a decent state of health. Because when you get that surgery, you got to be able to fight back. You got to be
So.
able to, get up and walk
Mm-hmm.
around and all of that. And you need to be in the best position and the best health that you possibly can. I
Mm-hmm.
just tell everybody, don't waste time. Just go ahead and get the workup done and get on the list. You can do all of that thinking and all of that stuff. Do that later. Get on the list now, because
Right,
time
right.
is ticking.
Mm-hmm.
Absolutely. I agree with you, Don. I definitely agree.
Yeah.
So look, we went over our time, but as we uh, begin to close the show down, just want to go around the room and get some parting words from each of our guests, starting with Don M. Dawson. What words can you leave our audience about for kidney's sake and in the of the organization?
Well, like I said earlier, for kidney's sake, we battle depression and isolation in dialysis patients, and our plan is to just keep showing patients that they can have joy and they can still have a life outside of dialysis. And dialysis is not the end of life. You still have a life to
Mm-hmm.
live. God gave us this life to live. We have to live it. We have to rock this till wheels fall off. And that's our
I
goal, to
hear
let
you.
them know that,
That's
dialysis
right.
stops no show.
Mm-hmm.
And like Andrew always says, I have kidney disease, but kidney disease does not have you. Do not let kidney disease stop you from living your life.
Right, absolutely. I
So,
agree with you 100%. Alex, as a transplant advocate, what
Mhm.
words of wisdom can you share with the audience as
I would,
we end the
sure,
broadcast?
sure. Yeah. So first, I want to just say thank you, Steve and Tamika, for having this platform this last year and change, and it's changed my life. But I would first say that what we've talked about in this conversation, it's education. Kind of give yourself as a patient as much education as you can. Equip yourself with the tools. Reach out to your family, reach out to your dialysis center, reach out to your nephrologist, and just ask questions. And there's nothing wrong like a stupid question. I think you can ultimately just kind of equip yourself with those tools as you get through this disease, as you start going through it. And if it's from the very beginning stages of stage 1, 2, and 3 to 4, 5, and getting into dialysis, I think that just continue to kind of advocate for yourself, be your best advocate, and don't, like you said, Dawn, earlier, don't let this disease. You're not. I'm not Alex, who's I am a kidney patient, but that's not my whole life. It's just part of what I do and part of who I am, but it's not. I don't let it kind of define me. And so I encourage folks to, understand that this is a disease, but it's not who you are completely, and to continue to just educate yourself and, get some tools for your toolbox for it.
Wow, very well said, Alex.
Thanks.
Don, you're the most veteran kidney warrior here. What words could you leave us with for 2020?
For me, this is the year of the kidney. I'm declaring that. I'm calling it out. I'm saying that this is it. We're gonna do bigger things, better things. We're gonna be doing things like never before. What I would say to our patients and our fellow warriors out there to continue to be strong, but don't just sit back and accept what's given to you. Pay attention to what's going on around you. Educate yourself. Read, listen, learn. Talk to people who have been on dialysis, longer than you. Talk to the staff members. Establish good relationships with your healthcare team. These are the people that are helping you stay alive. So, being able to have good communication with your doctor and the other
Yes.
members of your healthcare team is important.
Yes, very.
If you're going for that kidney transplant, get yourself up off your duff, make the appointment, and go out there and and press yourself, press your way. And I know it's not easy. I didn't feel good when I got off of the dialysis machine. When you come out off of dialysis, you don't feel like doing anything. But you just got to find that little light inside of yourself that makes you want to press your way and press as hard as you can to try to make a life for yourself. You can do it. Go get your transplant workup. If you think that you might even be able to do dialysis at home, the outcomes are so much better. You have more energy. It's healthier. You get less infections. Find out about it. Don't just say, I don't want that, because you don't know what you don't know. So just find out everything that you can about what it is that you're dealing with. And let's all do bigger and better things this year. Let's press for the mark. Let's get up out there and
I
let's get
agree.
some great things done in 2020.
I agree. It's going to take all of us. It's just not going to take one particular organization and person. It's going to have to be a collaboration, just like what we're doing tonight. We got three different people doing three different things in the kidney community. We have Don M. Dawson for Kidney Safe, Don P. Edwards. It goes around and speaks and advocacy as well as Alex Barrios, and they're in different parts. Even though Don is in New York, but y'all in different parts of the boroughs, right?
We're no, we're
Don and
oh
Don.
yeah, that's right.
Yeah,
I'm
but
in
not
Queens
too
and
far.
Oh, okay,
Not too far.
right. But still, I mean, it takes a collaboration, and we just can't do it alone. So it's going to take
no,
like
we
having
sure can't.
these type of conversations,
Takes a village.
discussions,
Mm-hmm.
and keep going.
Even
So,
yeah,
guys,
even
like
Steve.
to thank y'all for coming on. Or go ahead, Tamika.
Oh no, I was just gonna say, even you know how they have the Facebook groups for the patients. It should be a Facebook group for the organizations to figure out how to bring this out. Like they have cancer, breast cancer. You know about breast cancer. You know about prostate cancer, but you don't know about kidney disease. I'm confused. But if all of us get together and make a loud enough noise, knock down some doors, eventually they will bring us up also and raise more awareness for kidney disease too.
Mm-hmm.
But you can't do it like
Absolutely. I
one
agree.
organization can't do it. We got to come together.
You
Instead
sure
of
right
being
about
isolated,
that.
Absolutely.
You
come
just
together.
Yeah.
can't do it alone.
No,
Yeah.
Mm-hmm.
it's bigger than
Mm-hmm.
us.
It really is. It really is. So, guys, we like to thank you for coming on. Don P. Edwards, CEO of New York State's CKD Champions, Alex Barrios, kidney disease transplant advocate from Louisville, Kentucky, and without further ado, who is our special guest tonight, Don M. Dawson, the new CEO for Kidney's Sake. And we wish you, Don, the very, very best.
Thank you
I don't want
very,
to
very
say
much.
luck. We most power and what you're doing.
Thank
You're
you.
definitely in our prayers. And if you need anything, please don't hesitate to reach out and to touch us and
Thank you
ask
very,
any
very much.
questions or anything that we can assist you with
Thank you
or
so much.
collaborate with for
I'm
kidney's
gonna
sake
call you
as
on it. You
well.
know that. But thank you so much. I really, really appreciate the help. I appreciate the support from so many people. It's much appreciated. I love you all. Thank you very, very much.
All
Thank
right, Don. We see you later.
you. See you later.
All right. All right,
All
Alex.
right
I
now.
All right,
definitely
you
see
guys.
you. Thanks for joining the show.
Yeah.
All right. Oops. And Don, definitely
Yes, darling.
enjoyed you being on the show. Really
Yeah.
appreciate your your input.
Oh, thank you so much. You know, I'm always available for you guys. I love you all. I love what you're doing. It's great to be a part of what's going forward here.
All right, Don. Talk to you soon.
Talk to you
All
soon.
right now.
Love
Take
you.
care.
All
Take
right.
care, Tamika. Love you, baby.
Love you
All right.
too.
Love you too. All right. Tamika, this has been an awesome show. I mean, I believe one of the best,
Sure.
if not the best.
Yeah, I think like if more organizations honestly get together and take away the I'm trying to do, and together we can really make change.
Oh, absolutely. Absolutely.
You know,
So go ahead.
I think that's the only way that we're going to get the information out with the disease is if more organizations are doing it. You know,
I agree with you 100%. And hopefully in 2020, we can make that happen and hopefully spearhead it.
you're right.
Mm-hmm. So to make it wonderful, yeah, I just like to say that I love you. I'm glad that you're my partner. We've been together, I think, what, 3 years or 2.5 years?
Yes, now. We
Yeah,
met
2 years. I mean, yeah, two healthcare workers in different states doing the same thing and coming together and trying to make a bigger difference. I couldn't have, well, I didn't pick, you picked me, but I couldn't have been with a better person, human being. We all have our issues and everything, but man, I just love you to death. And I just look forward to keep doing this until we can't do it no more.
Yes. I love you also, Steve. I love you.
Yeah.
Or my brother. Yeah,
Absolutely.
Tears start coming down, but
No, absolutely. So until next week, guys, we're going to have another great show for you next week. I'm not sure what we're going to be talking about, but we're definitely going to have an awesome show.
Yes, and if you guys
until next
show ideas, I'm sorry, I'm just don't know. If you guys have any show ideas that would be beneficial, please let us know. We just want to.
Yeah, we always ask, you got any show ideas? Please reach out to us. We'll definitely do it. Definitely do it. All right, Tamika, I definitely talk with you. And like I said, love you. Take care. Take care, my little goddaughter Zoe as well.
I will.
All right. Talk to you soon, babe.
Good night.
All right. Good night.